Sir, news from the underground.
Hello, welcome to The Underground. This is the podcast where we talk about the world and how crazy and weird and messed up it is. I'm your host, Duncan Michael McPherson. Today on the podcast, I want to talk about a new study. I just read this from Dr. Robert Malone, who is one of the inventors of the COVID or the mRNA vaccines. And he posted this article from the Washington Times. Now, the Washington Times, if you can see my screen, is known as a conservative newspaper, but I wanted to look at, that's why I want to look at the actual study. So they say COVID-19 lockdowns cause more deaths instead of reducing them, study finds. And so I looked at the people who did the study, which is the RAND Corporation. I didn't find anything that suggested they were biased or anything like that. So I don't know. But anyway, let's go to the actual paper. So this is from the actual study that they did, and I'm just going to read this and kind of stop in between. So this is kind of their discussion on the results. Nonetheless, the implementation of SIP, which stands for shelter in place, which is used in a synonym for lockdowns, implementation of shelter in place policies does not appear to have met the aim of reducing excess mortality. There are several potential explanations for this finding. First, it is possible that shelter in place policies do not slow COVID-19 transmission. As discussed earlier, prior studies find only a modest effect of shelter-in-place policies on mobility. A potential reason for the modest impact on mobility may be that individuals change behavior to avoid COVID-19 risk, even in the absence of shelter-in-place policies. It is also unclear whether modest reductions in mobility could slow the spread of the airborne pathogen. So, we didn't need the policies because people were doing it anyway. That's basically what it's saying. So places like Sweden that didn't have shelter-in-place policies, as far as I know, did just as well as every other country because you don't need mandates. And this has been my problem from the beginning. We don't need to mandate everything. We mandated masks. We make it illegal for you to not wear a mask. That's stupid. You make it illegal for people to leave their homes. Ridiculous. So just ask people, just tell people this is the best way to stop COVID, and people will do it. That's what this proves. We don't need to, enforce everything. But that's how we do things. So second, it is possible that the SIP policies increase deaths of despair due to economic and social isolation effects of shelter-in-place policies. Recent estimates in the U.S. between March and August 2020 show that drug overdoses, homicides, and unintentional injuries increased in 2020, while suicides declined. I actually heard that in 2021, suicides started going back up, but I don't know. I don't have any proof for that, so I don't want to talk about it. Third, existing studies suggest that SIP policies led to a reduction in COVID-19 healthcare, which might have contributed to an increase in non-COVID-19 deaths. For example, one study in the United Kingdom predicts that there will be approximately an additional 3,000 deaths within 5 years due to a delay in diagnostics because of the COVID-19 pandemic. So people who had surgeries booked and needed chemotherapy or heart surgery or whatever, that stuff got delayed and killed more people than the COVID actually killed people. So more people died from probably a combination of these things, right? Lockdowns didn't work as well as we hoped. People died of other things because they were depressed. Overdoses, homicides, unintentional injuries. They talk about domestic abuse might have gone up or something earlier in this. And then, not taking care of people's health. And this agrees, so this is 43 countries that they're studying. This agrees with what Canada, this is from Stats Canada, and I did a video on this already, that showed that there were more excess deaths from other things that the lockdown might have caused than from COVID itself. So, while we sometimes observe excess mortality that is consistent with the number of deaths attributed to COVID-19, data reveal that indirect consequences of the pandemic are also having a significant impact on the number of excess deaths in Canada, particularly among younger Canadians. So this represents 5,535 more deaths than expected were there no pandemic, after accounting for changes in the population such as aging. Over the same period, 1,380 COVID-19 deaths have been attributed to the same age group, those under 65, suggesting that the excess mortality is in large part related to other factors such as increases in the number of deaths attributed to causes associated with substance use and misuse, including unintentional accidental poisonings and diseases and conditions related to alcohol consumption. So, our lockdowns killed more people than COVID did. That's what I take from this. What were we thinking? It was a bad idea from the beginning, and, we went along with it. Well, some of us did. I did not, but I don't want to be self-righteous. Anyway, so I think lockdowns were a terrible idea. I mean, I think like maybe at first we didn't know what to do. The idea of flattening the curve, okay, I can get on board with that. But after a while, we realized that we got to do something else. And we're still putting all of our eggs in baskets that are disappointing. And I think eventually we're going to have to figure out a way to live with this disease. So anyway, that's all I got for today. Thanks for listening. Hey, thanks for listening to The Underground. Please subscribe on YouTube and like and share it on social media if you'd like to see more content like this. Thanks, everybody. Bye.